We have invited Dr. Gude to speak about vitamin D deficiency and care for seniors. And because given the fact that this is such a critical, concern of senior citizens, and not just senior citizens, even younger people, but more so in the case of senior citizens. Thank you for accepting our invitation, Dr. Gude, and welcome once again to Health Live at Seniors Today.
Thank you, sir.
Dr. Gude, we have been we've been looking at a lot of ailments over the last 3.5 years that we have been we've been featuring Health Live every Saturday evening. And while we have spoken about vitamin D through various sessions, but this is the first exclusive session that we are having on vitamin D, given the request that is coming from a lot of our attendees, patients, etc. I just before I request you to make a presentation, I want to ask you that has this issue about vitamin D deficiency, concerns about vitamin D deficiency, is it always been there, or has it increased over the last few years?
Yeah, I think it has been there, sir, always. Only thing we have been finding out about it a little more. There is more awareness, there's more diagnosis and treatment happening in the last 10 years compared to last 20, 30 years. But yes, vitamin D deficiency is something which has been there always.
Right, thank you. But perhaps many of us don't like to get out in the sun these days, and get the right amount of sunlight. Over to you, Doctor, for your presentation. As always, all of you here, we will, Dr. Gude is in the house. We will invite him to, we've invited him to speak about the subject of today, which is on vitamin D deficiency. After that, if you have any questions, you can put them in the Q&A tab, and we will address them after this directly to Dr. Gude. Over to you, Doctor.
Right, sir. Thank you. Let me share my screen.
Yeah. Great.
Yeah, so I'm Dr. Dilip Gude, and thank you for having me. So for the next 10 minutes or so, 10, 15 minutes, I'll be talking about vitamin D and why is it really important, and are there any other problems associated with having low vitamin D? Not just, we know bones and bone health and musculoskeletal health, vitamin D is very important. And we will see what happens when you don't supplement vitamin D in accurate quantity. And there are metabolic conditions which are non just musculoskeletal, as in diabetes, hypertension, heart disease, and so many other diseases that can actually worsen when there is vitamin D insufficiency or deficiency. So we'll tackle, we'll keep addressing these deficiencies, and we will see what we can do to address these disorders, which will actually flare up when there is a vitamin D insufficiency, how to treat them, and what are the different ways we can treat. All those things we will discuss in the next 15 minutes. And after my session, I welcome you all to ask me questions, and we'll keep it as interactive as possible. So yes, we will look at the epidemiology, as in how important, how widespread is the problem, and then the causes. Why do we get vitamin D deficiency? And things beyond musculoskeletal health, that is cardiovascular, diabetes. There's a role in immunity as well for vitamin D. And then we'll also look at the types of vitamin D supplementation. The newer nanotechnology supplements are known to give higher bioavailability of vitamin D, thereby improving and increasing the pattern at which we are targeting these vitamin D deficiencies. So it is an important nutrient for the whole body. In fact, it is important for the good functioning of every system in the body, including lungs. It can actually prevent the breast cancer, adequate supplementation. Your grip strength, your forearm muscles, your hand muscles, all those can give they are telltale signs which you can see in the palm, when one is chronically vitamin D deficient. And then, of course, we all know about bone health. That is, there is osteopenia, there is osteoporosis, osteoarthritis, and all these can flare up with inadequate vitamin D supplementation. And what really happens with sun exposure, how we chronically under deprived of sunlight we are all, especially the urban population, we all are aware of it. And then there are various other allergic disorders. Hypertension has a direct role with vitamin D deficiency. Correlation, in fact, skin diseases, prostate conditions, in fact, falls are also increased when there is inadequate vitamin D in the body. So there are some studies that say that up to 80% roughly of Indians have insufficient vitamin D levels. You want vitamin D level above 30, 30 to 40, 30 to 50 at least. That is a normal level. 20 to 30 is insufficiency and less than 20 is deficiency. Right. So diet, why is Indian population chronically so vitamin D deficient? So there are some parameters. There are some things, aspects that are blamed, like diet, the kind of diet we eat. There, it is not really vitamin D fortified. There is increased melanin content in our skin. There is inadequate sunlight exposure. This is the most important parameter in the last 20 years or so, especially the urban population. And then the lack of fortified foods, which contribute to the vitamin D deficiency in India. And since sunlight is one very important aspect, but then when you are depriving one of adequate sunlight, you are definitely encouraging vitamin D deficiency. There is dietary sources, predominantly non-vegetarian sources are known to give good vitamin D. And then vegetarians, only vegetarian source is sun-exposed mushrooms. But again, not all of us have mushrooms. And then vitamin D fortified foods are available in Western countries, but in India, some places are having vitamin D fortified milk supply, but not every town or village. And then we know vitamin D plays a very important role in calcium metabolism. And there are two important areas where hydroxylation of vitamin D occurs. One is liver, that is 25 hydroxylation, and the next is kidneys, where 1/25, 1 and 25 hydroxylation occurs in the vitamin D. And this all improves mineral balance, calcium homeostasis in the bones. So there is UVB related deficiency with advancing age, dark skin, and then extensive use of sunscreen, which actually prevents the UV that helps change the vitamin D in the skin, and of course seasonal changes. And then the latitude also, where in the how close to the equator or is your town or village situated. The closer, the higher the vitamin D level. And medical and physical or condition-related deficiencies like fat malabsorption, drug-induced, liver and chronic kidney disease, as we know, 25 hydroxylation and 125 hydroxylation occur at liver and kidney respectively. And when you have these diseases, you are definitely going to have that particular vitamin D deficiency. Obesity itself is a vitamin D deficient condition, and then smoking itself increases vitamin D deficiency. And signs and symptoms of vitamin D deficiency. Chronic vitamin D deficiency can cause proximal muscle weakness, which makes one have a waddling gait. And there can be ribcage and tenderness and presentation with fractures as well. And there are symptoms like isolated or generalized aches and pains in bones and muscles, muscle weakness, difficulty in squatting, standing, walking, and more frequent falls as well. So these are the levels that we all should aim for. That is less than 20 is deficiency, then 20 to 30 is insufficiency, greater than 30 is sufficiency. And we all should strive for having levels beyond 30, 30 to 50, 30 to 60 are good levels. And methods used to assess vitamin D, we usually do a blood test, serum vitamin D level, and it has a longer half-life of about 3 weeks and higher blood concentration other than other metabolites, and it represents the convergence of all forms of vitamin D. And there are also other ways in which you can assess vitamin D deficiency. And so beyond musculoskeletal health, like we said, hypertension, diabetes, heart disease, they're all affected. They're adversely affected when there is vitamin D deficiency. Hypertension, especially, again, I will not go into the details of how, but then it is sufficient to understand that if you have chronic vitamin D deficiency, your hypertension may actually worsen. The dose required to control your BP and the number of medicines required to control your BP may be higher when you are chronically vitamin D deficient. So a little too technical and complicated, but I will not go through these. And so vascular endothelium means the lining inside these major arteries. Those are also going to benefit if there is adequate vitamin D in the body. And adversely, if there is lack of vitamin D, your endothelial dysfunction is also known to occur. There are studies that substantiate this. And this is the pathway that explains how one gets higher blood pressure because of chronically deprived vitamin D status. Now, diabetes. Again, this is an important causative correlation. There is chronic vitamin D deficiency. People are known to have increased insulin resistance, which means your amount of insulin per day. If you have been taking, say, 30 units of insulin per day, you may be required to take 40 units of per day, 40 units of insulin per day if you are chronically vitamin D deficient. So, insulin requirement may go up. The need for insulin may go up. The need for oral anti-diabetic medications, these also can go up. You may actually become overweight or obese. So it is a complex pathway. So diabetes is also adversely affected by vitamin D deficiency. Again, a little technical, I will not go into these details. And role in immunity in infections, also it's pretty strong correlation is there. So vitamin D, having adequate vitamin D improves barrier to infections. It improves adaptive immunity and even cellular immunity, as in improves antibody-mediated humoral immunity on one side. And then cell-mediated immunity is another thing. So there are two different types of immunity, and both of them will benefit when there is adequate vitamin D level. And conversely, when you have decreased vitamin D level in the body, then of course your immunity takes a hit, both humoral and cellular cell-mediated immunity. So various respiratory tract infections, urinary tract infections, TB can flare up also when there is vitamin D deficiency. So much that there is historically in the 1900s, basically in the US, when there is tuberculosis widespread, they used to relocate people to where there is a lot of sunlight. There are some areas where there is not much sunlight at all. So people who had TB improved when there is chronic sunlight exposure, along with, of course, TB medicines. So there is a substantial role of vitamin D in improving or fighting, infections, improving your immunity. And in fact, vaccine-mediated immunity also improves. We have seen that in COVID as well. People who are chronically vitamin D deficient, they did not fare well when they had contracted COVID as well. So respiratory tract infections, various viral, bacterial, pneumonia infections, and all those are known to flare up in conditions where there is chronic vitamin D deficiency. Yeah, how to give a therapeutic dose of vitamin D and all we will see in the coming slides. Right. So one can actually take a 60,000 unit tablet or a gel form or a liquid, a nano liquid once a week as 60,000 international units, or one can take a injection of 1.2 lakh, once a month, or one can have a 1,000 to 2,000 international units everyday capsule, and then of course the parent release the mega dose of 6 lakh unit, injection depot preparation, which will last for 1 or 2 months. Most importantly, the problem is people take these vitamin D tablets as per doctors say. They take for 3 months and then they stop it. The problem comes when you stop it because your vitamin D level slowly fades out. After 3 weeks or so, your vitamin D level may actually go back to how much it was when you began the treatment. So it is really important that you take a maintenance dose, probably for lifetime. Okay, so the crux, if there is one take-home point that we all should go from this presentation of mine, is that after taking the therapeutic dose for 3 weeks or 4 weeks, 12 weeks or 16 weeks, you will need a maintenance dose, which may be forever, right? Because of the kind of lifestyle we have, the urban lifestyle, or the diet that we take, the non-fortified vitamin D, non-fortified diet that we take, and various other causes, we may actually go back to having lower vitamin D levels after taking the 3 or 4 month vitamin D period. So it's always important and understand that you may need a vitamin D tablet or a injection for forever, which is a maintenance dose. And forget about toxicity. Do not think about, okay, if I take vitamin D for longer periods of time, I may go into vitamin D toxicity. That is noted, but then that is very, very rare. People having beyond 120 units of blood level of vitamin D is extremely rare. In fact, I have not encountered such patient. There was one patient who had 120, 130, but then we just stopped the vitamin D for 2 months, and then automatically patient improved. So it is a pretty safe tablet to take, or a an injection, or whichever form that you're going to take, and do not think about toxicity. So maintenance therapy may be forever. This is the take-home point. And then we also have a nanotechnology. Some of the vitamin D levels may not improve adequately, and it may not be palatable also. And then with the nano formulation, you may have improved bioavailability and absorption, and even a longer stay in the blood level compared to the non-nano form of vitamin D. So what I'll do, I'll stop here. I'll invite questions and comments, because it may get technical after this. So yes, I'll open the floor for questions.
Hello,
Please,
hello. Yeah.
Yes, sir.
Thank
Go
you
ahead.
very much. Thank you very much for your session and a very detailed presentation. Thank you very much. Doctor, we've got quite a few questions which have come in. Some of these are here, and some of these are have come to me by WhatsApp. Doctor, a question that has come in about vitamin D deficiency is that is deficiency of vitamin D a hereditary issue?
No.
If I, as in the
No,
person
sir,
is saying that the person has said that I have had vitamin D deficiency. Is it likely that my daughter, who is 50, would also be facing it? I'm 80 years old.
No, sir. Vitamin D deficiency per se as a condition is not hereditary, but there may be conditions which may worsen it. As in, say, you may have a gastrointestinal problem, which may be hereditary, okay, which may hamper absorption of vitamin D through the fortified foods that you take, through either the fortified milk or the supplements that you take. They may not be absorbing very well because of a genetic condition that you may be having in the gastrointestinal system, or if you may have a liver disease or a kidney disease, which may be hereditary. But vitamin D deficiency per se is not hereditary, and I think for the answer for that particular question is that no, it is not hereditary.
Right. Thank you. We have a question from Mr. Rajnikant Gilani, who's 71, who asks, I'm a male diabetic. Is it okay to take Uprise 60K once a week, lifelong?
Not really, sir. After taking it for 4 months, that is 16 weeks, 12 to 16 weeks, you need to down titrate it. As in, you need to make it once a month instead of once a week. The same 60,000 units that you're taking, take it, say, first of every month, so that makes you remember it. So, because yes, first of every month, if you're taking it, that dose once monthly 60,000 can be lifelong, can be a maintenance dose.
Doctor, I must tell you
week.
this out of my own experience. I used to take Uprise also every day, and then I was told that there should be a bit of a break after 3 months or whatever. Is that what is advised?
Not a break, sir. We just need to down titrate it. There's no break as such. If you're taking, obviously you're not taking Uprise D3 60K every day, because 60,000 every day is a high dose. We don't
Right.
recommend that. 60,000 units is something you need to take once a week,
Right.
say
Once a
every
week,
Sunday,
sorry.
for example.
Yeah.
Yes. So, but after a while, you have to downgrade it to once a month. That is a safe way to downgrade it. And once you make it once a month, I think, given the kind of scenario we are all living in, we need to all take once a month, probably forever. That is going to be the maintenance dose.
We have a question from Shailaja Ganguly and an anonymous attendee. How much exposure to sunlight daily and what time would you recommend?
Yeah. So we need to walk a tightrope here, meaning we should not get too much exposed to the UV ultraviolet rays, which may be cancer causing and all. On the other hand, we should not be staying so less that we don't get adequate vitamin D. So there is a line in between. And for that, I think 15 minutes of sunlight exposure twice daily. So 15 plus 15, 30 minutes of sunlight exposure around 10 a.m. to 12 p.m. 15 minutes, and then from say 4 p.m. to 5 p.m. another 15 minutes. Now, why do I say do not do the 12 p.m. to 4 p.m. is because that's when the ultraviolet rays are the strongest, and then we generally don't recommend that particular time frame. But if it is a 9 a.m. to 12 p.m., 15-20 minutes, and then say 3 p.m. to 5 p.m., another 15-20 minutes would be adequate level of vitamin D producing sunlight exposure.
Doctor, the kind of number of questions that we've got today it just shows that there is a fair amount of hunger for good information on vitamin D. We have a question from Mr. Rajiv Muradar who asks, is it sufficient to take vitamin D capsules during the winter months? I guess he means only in the winter months.
Yeah. So when there is no sunlight exposure, definitely vitamin D supplementation needs to be taken. But the kind of lifestyle we are all living in, even in summers and all, I mean, it's not like we are going to have so much sunlight exposure because of the way there is sunscreen application, there is full sleeves. If you're wearing full sleeve dress, and then if you're not getting adequate sunlight exposure, even in summers, we need to take vitamin D supplementation. But in winters, yes, we all need to definitely take supplementation, either an initiation dose or maintenance dose as required.
Right. Thank you. We have a question from Mr. Satish Kalia, who's 78. He is a diabetic. He says, if vitamin D is 25, hydroxy serum level is if 65, 68. Is it natural and okay by at his age, which is 78? And
Yes, sir.
his doctor has recommended cholecalciferol shells
Yes.
once a week. What is your opinion, he asks.
So your level is good, sir. 65 international units in your blood is a good level. And if your doctor has suggested once a week, then I would say that you can continue it, because 65 is good. 30 to 70 is a good therapeutic window for vitamin D. So it's not that if you're going to continue it once a week, you're not going to have higher levels. No, that 65 can be maintained by taking it once a week. So you're on cholecalciferol 60,000 units once weekly, if I understand it right. And it is a good dose. You can continue. It actually helps your diabetic blood sugar control as well, having adequate level of vitamin D.
Right. Thank you. We have a question from Mr. Lakshminarayanji, who is 68. He had borderline sugar going through a reversal. During his recent test, he says he found vitamin D to be 5.24. This is low, but doctor looked at all other parameters and ignored it. But the symptoms are not showing for me. Bangalore has very limited sun exposure. Need a good solution.
Yeah. So now the thing is, there is a broad, what do you call, spectrum of signs and symptoms of vitamin D deficiency. As in, some people, even at 20 vitamin D level, they may have myalgia, as in muscle pains, joint pains, and all. Some people who have 5, like you, for example, will not have any symptoms. But if you have 5, it is imperative. It is very important that you be on vitamin D supplementation. Be it once monthly injection. I mean, if I were treating you, I would give you a once monthly shot of 6 lakh international units right away, and then follow it up after 2 weeks with tablets, that is 60,000 units once weekly tablets. So we have to ensure that your vitamin D level is at least 30 to 50. So that is the level. And no, the problem with vitamin D deficiency is you don't know the problems, signs and symptoms, or how it affects other metabolic conditions like hypertension, diabetes, cardiovascular disease, immunity, and all immediately. You don't know these, these presentations immediately. But then there is damage occurring as we speak. We need to stop that. We need to reverse it. So it is really important and imperative that either once a month injection of 6 lakh units or a once weekly 60,000 units need to be given to you. Make sure we maintain your vitamin D level of at least 30 to 50 for a long period of time.
Thank you. We have a question from Vijay Lakshmi Ganduri. Says, Dr. Dermatologist suggests that we should apply sunscreen lotion every 3 to 4 hours to protect our skin from aging issues. Now, in your presentation, you mentioned that sufficient sunscreen is also a reason for vitamin D deficiency. So how does one balance both skin and vitamin D issues? I think a good question.
Right. So now, again, like I said, we all understand the balance part. I think the question itself has the balance word in it, which means that, say I will not put sunscreen and go out at say 12 p.m. to 4 p.m., which is when the sun is the brightest and the UVB ultraviolet rays are the maximum at that time. So I would rather not go out at that particular time. But then when I'm going on the other times, I will not put a very thick sunscreen, right? So in fact, sunscreen lotions are suggested even during the evening and night, because exposure and radiation from say laptops, for example, or mobile screens and all, those are also going to add to your aging, right? So in that scenario, you can apply a sunscreen lotion of 50 SPF, for example. But then you can always balance it with some amount of oral supplementation or injectable supplementation of vitamin D on one hand. Get some exposure of sunlight during the time frame that I discussed about, and then walk the balanced line. Don't get yourself exposed during the peak hours of sunlight. And when you're using sunscreen, make sure it is not too thick. As in, people start using 70 SPF and all, but that's not required, and that may discourage any kind of sunlight penetration, and it will discourage vitamin D production in the body. So I think 30 is still okay. SPF 30 or SPF 50 is still fine, but we need to go walk a balanced rope on that aspect.
Right. Thank you, Doctor. Doctor, we have quite a few questions which are similar. I'm just going to ask two more questions, Doctor. Is it, we've got three questions which are similar, which are saying, what are the natural sources of vitamin D besides sunlight that people should look at? Is it necessary to take vitamin D with calcium supplements?
Right.
These are,
so
we've got quite a few questions on that.
Right. Now, if you're having good dairy products, say you're having milk, you're having curd every day, twice daily, you just need to take vitamin D supplementation. You don't need calcium. But then if you're taking a lot of calcium, for example, but then for some reason your vitamin D level is very low, all this calcium is not really absorbed by the gut, by the gastrointestinal system into the blood, right? If you have a lot of calcium in your diet, but then your vitamin D level is low, it is of no use. So it's always a combination of both. So you need adequate vitamin D to make sure the calcium that you take is actually absorbed and assimilated into your bones and into various other organ systems. So now, what are the diets that help? Non-vegetarian diets definitely help. Chicken, fish, and all. We don't recommend mutton, that is the red meat at all. But yes, chicken and egg, and of course, we don't recommend yellow for senior citizens. But egg white is a good source. Milk is a very good source. All dairy products are good sources. And then even green leafy vegetables are also good sources. So, but always remember that you need adequate vitamin D level in your body to make sure the calcium that you're taking in reaches your bones and various other health, various other systems. I hope that answers.
Absolutely, Doctor. Thank you very much for a very detailed presentation and for very painstakingly answering all our questions today. As always, we are really delighted that the medical fraternity is always around for our attendees, for our readers of Seniors Today. As always, this session, the edited video, as well as the takeaways, which are written by a medical practitioner, will be up on the Seniors Today website on Monday evening or perhaps Tuesday. Thank you very much, Doctor, for being there. And thank you to the team at Yashoda Hospitals for facilitating this. Thank you very much. And to all of you here, we will be back again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. You can pre-register. The pre-registration notices are there in the chat window, as well as all the other features that we do at Seniors Today. Thank you very much once again, Dr. Gude. Thank you very much.